A very good day to all. Our group consisting of 6 members, including myself, Brandon, and Wenjie, which are the presenters for today, along with Xunwei, Susan, Weibing, and Mingxian, have chosen the topic of handling dental emergencies in COVID-19 pandemic to present. So before starting, let's have a brief knowledge on the meaning of dental emergencies first. Dental emergency is defined as the issue involving the teeth and supporting tissues that is of high importance to be treated by the relevant professional, which include heavy bleeding that does not stop or even facial swelling, as well as infections that makes breathing difficult or severe toothache that interferes with patients' daily life. Since COVID-19 spreads mainly through respiratory droplets, and dental treatment usually deals with lots of saliva and fluids from the oral cavity, therefore, dental clinicians should take additional precautions when handling patients in dental emergencies to avoid the transmission of coronavirus. But what are the precautions dentists should take, and that we will share it to the audience in a moment. Now let's have a look at how patients are handling dental emergencies during the COVID-19 pandemic first. So as we know, dental treatments are mostly face-to-face. However, COVID-19 has been an obstacle for us to proceed with the usual face-to-face treatment in clinics. Therefore, teledentistry is a good way of getting consultation from a dentist and preventing the transmission of the COVID-19 disease at the same time. So this teledentistry refers to the use of telecommunication technology, digital diagnostic imaging services, computers and software for analysis and follow-up instead of the traditional face-to-face treatment. Patients are able to conduct teleconsultation with dentists, which means they can switch on the camera or webcam to show the dental conditions to dentists and let the dentists assess their dental emergencies and give treatment verbally. Thus, with this method, dental treatments and consultations will become much more convenient during the pandemic. Overseas, such as US or Canada, patients can even Google up a website called Lumino Health or Lumino the Dentist to request an appointment by just entering your address, and the system will automatically recommend a dental clinic nearby your living area, in which this website ultimately makes things much easier for dental appointment. Now, moving on, I'm going to share on a few tips on handling some of the most common dental emergencies met by patients. These few steps might not entirely solve the problem, but at least it may provide certain amount of temporary relief to the patient. So for instance, if you are facing toothaches, you can choose to rinse your mouth using warm water thoroughly, or apply a cold compress to the outside of the mouth or cheek, which will help to relieve the pain. However, please do take note to never apply painkillers directly on the gums or soft tissues, as it may burn them. Now, if you have broken braces wire or brackets, try to use the eraser end of a pencil to push the braces wire into a more appropriate position. But if you fail to reposition it, you can cover the end with orthodontic waxes, which in the meantime will protect your gums and soft tissues in the oral cavity from getting injured by the sharp metal orthodontic wire. Next, if you are suffering from an extruded tooth or a tooth that has been partially knocked out of its tooth socket or original position, try to maneuver the extruded tooth back into place gently and avoid chewing with that particular tooth as well. You can also take ibuprofen or any other over-the-counter analgesics to relieve the pain, but it is advised to receive dental treatment immediately once available. Now, the last step I'll be sharing is for abscess in the oral cavity. So abscess means the collection of pus fluid caused by a bacterial infection. So try rinsing with salt water and take painkillers to relieve some of discomfort while waiting for a dental appointment if you have an abscess. Now, that's all for my part. So I'll be passing on to my friend, Wenjie, to continue. Thank you.
Thank you, Brandon. Despite the large-scale community transmission of COVID-19 during the pandemic, the demand for urgent dental treatment only decreased by 38%. So as you can see, this shows that the public really needs for dental treatment, urgent dental care. So even though during this whole pandemic happens, first, urgent dental treatment will be essential. But before that, precautions must be given. So now I'll be briefly run through the guidance to handle patient during the pandemic. First of all, screening everyone before entering a dental healthcare facility with temperature gun, so that everyone, including the workers themselves, as well as the patients and visitors. So this step is to ensure that their temperature are all between a normal range, which is 36 to 37 degrees. And every workers, including dentists, must ensure that patients or visitors must adhere to hand hygiene and cough etiquette while inside the facility, which means before or after they enter the building, the workers must put an eye on the visitors, making sure all of them have done a proper, complete sanitized procedure, as well as checking them whether they have any symptoms of COVID-19. So second, will be dental workers themselves. As part of the routine practice, DHCP, as known as dental healthcare personnel, should ask to regularly monitor themselves for fever and symptoms consistent with COVID-19. If one of them suspect that they have any symptoms of COVID-19 or they have COVID-19, they should not come to work and stay at home. Third, a dental clinic should create a process to respond to COVID-19 exposures among dental healthcare personnel and others. And fourth, implement controls measures for example, patients and visitors should wear face masks or face shield to cover their mouth and nose. So by wearing a mask or any protective equipment is very essential in order to protect themselves whenever they are having a short distance conversation in the clinic. Dental healthcare personnel also should use their own personal protective equipment at all times while they are in the dental setting, so that patient will feel much more safety during the whole entire dental treatment procedure. Next, encourage physical distancing. A patient or visitors must maintain at least 1 meters between each other in dental clinic. So for the dental healthcare personnel part, they can limit the number of patients to the facility by scheduling appointment. Therefore, this step can minimize the number of people in waiting room. In addition, dentists can also schedule appointment priority to those dental emergency. Through this way, by reducing the number of patient or visitors in the clinic, uh, most of or all of the visitors or the patients will feel much more safety to visit and make an appointment without any unnecessary thought. Number six, optimize the use of engineering control. For example, proper maintaining ventilation system and provide a air movement in a clean to less clean flow direction. Last but not least, environmental infection control. Dental healthcare personnel should ensure the environmental cleaning, disinfection, and sterilization procedures are followed consistently and correctly after each patient. Moreover, provide hand sanitizer at the door side so that everyone can sanitize their hand before and after they visit the dental clinic. Next, so how dentists are handling dental emergency in COVID-19 pandemic. So as you can see now, there are three roles which are divided into various scenarios of dental emergencies, their own management and cautions. So I'll be introducing one by one. So first of all, scenario one would be toothache, fracture, or chipped tooth. For the management, dentists will prescribe an analgesic, is either acetaminophen or ibuprofen, and dentists also advise patients to avoid hot or cold beverage and food. So if the tooth is very sensitive, they are also advised to use desensitizing toothpaste and soft toothbrush. And for abrasion or cuts in the mouth, advise using chlorhexidine mouthwash and analgesic gels to avoid infections. And fifth, maintain to chip tooth will temporary filling kit and the later permanent date is fixed. For the caution, so if trauma is caused, then this should inquire about any nausea or loss of consciousness experienced by the patient. If so, they are required to seek for immediate emergency services. If the trauma is mild and is self-manageable, then the patient should seek dental services when it returns unbearable. Second, the second scenario will be lost feelings or crown. Uh, for the same thing, prescribed analgesic will be given if necessary. And if the crown is stable, patient may self-treat through proper instruction on usage of temporary crown cement kit, and the later date for appointment will be fixed. And if they are chronic sensitive, advice will be given to use sensitizing toothpaste and soft toothbrush. If there's any pain or swelling or fear of infection, which may have occurred, patients are advised to seek for dental services immediately. Third, third scenario will be mouth ulcer. So dentists should emphasize oral hygiene advice and use chlorhexidine mouthwash. And they also advise to apply topical gel, for example, benzodiazepine hydrochloride for local pain relief. And also they are also asked to avoid triggers, for example, spicy food or smoking. If the ulcer are non-healing or non-painful for about 2 weeks or more, so the patient should seek immediate dental assistance for assessment. But if the patient has a history of mouth ulcer, they are best to consult their own general practitioner for investigation. And fourth, bleeding or sore gums. Uh, their dentist should emphasize patients on oral hygiene advice. And if bleeding frequently happens and has bad smell or taste, patients are advised to rinse their mouth with chlorhexidine mouthwash. An appointment date must be fixed to search for the underlying causes. But for the scenario, if the patient is smoker, they are advised to stop their own smoking habits. For cautions, pregnant and diabetic patients tend to bleed more. Therefore, their priority is to go to a dental clinic to seek for dental advice, which is very much recommended in order to eliminate other causes if fever or ulceration continue to happen. Fifth scenario, sensitive teeth. Patients are advised to implement soft diet and avoid pain triggers. And their dentists will also apply desensitizing toothpaste to relieve pain temporarily. Third, provide patients with oral hygiene advice. And if the patient agrees, they must set appointment date to determine the underlying causes for sensitive felt. And patients should seek immediate dental services if the pain is unbearable and is non-self-manageable. Last but not least, teething. Parents or guardians should be informed on teething or primary teeth starts, which starts at 6 months until roughly 2-3 years, as well as teething of secondary teeth, which starts at almost 6 years. This is to ensure that the parents always take an eye on their children's dental appointment. And third, prescribe sugar-free liquid paracetamol or ibuprofen for pain, and inform parents, guardians that teething symptoms is self-limited, and ensure that infants adequately hydrated to avoid regularly consumption of pure sweet food, as they will lead to tooth decay. And their caution will be always be aware of any serious infection if the child starts having fever, and last, contact their general practitioner if they are concerned about their children's health. So that's all. Thank you.
So in conclusion, both dental practitioners and patients should adhere strictly to the pandemic guidelines and SOP during emergency dental treatments to minimize the risk of infection. So we have to adapt to the new norm, and there's no other choice. And by doing so, we can protect ourselves as well as our close ones. And so that is all from our group. Thank you.